following video aims to provide a brief overview of depression and to inform you of some basic concepts associated with it. By the end of this presentation, you should be able to distinguish some common signs and symptoms of depression, explain common causes of depression, and describe effective coping strategies shown to be helpful for managing depression. So what exactly is depression? Depression is a term that most people have heard before, but don't know exactly what it means. It is a condition that can drastically affect a person's life and overall well-being. Depression is defined as a mood disorder that can cause a person to have persistent feelings of sadness, hopelessness, and a loss of interest in normal activities. It is important to note that these feelings have to be persistent and occur regularly for the person to be diagnosed as having depression. There are many different signs and symptoms of depression that can vary from person to person. These are just a few of the more common signs and symptoms that an individual may experience. Symptoms include feelings of sadness, anger or irritability, loss of appetite, loss of interest in activities, and trouble sleeping. It is important to remember that what separates depression symptoms with those of sadness is that in sufferers of depression, these symptoms are present for greater than 2 weeks and significantly impact a person's day-to-day life. Each person who has depression is unique. Therefore, each case of depression and the causes that went into the development of the disease are different and highly variable. Although there are many reasons a person may develop depression, here are 5 of the most common causes of depression, which can occur alone or in conjunction with one or more other causes. One of the most common causes for the development of depression is stressful life events. These may be any traumatic occurrences in one's life, such as the loss of a child, a parent, or a job. While most people who are dealing with stressful life events do not develop long-term depression, these events are a big factor for those who do. A second major cause of depression is genetics. Genetics determine how our bodies will naturally respond to stress. Those who have a family member who is depressed are more likely to be depressed themselves. However, there is no known specific gene that causes depression. For some people, their depression is brought on during the winter months. This condition is called seasonal affective disorder, or SAD. There are also many medications whose side effects include the development of depression. Some examples of medications that can cause depression are heart and blood pressure medications, taking certain hormones, and antibiotics. It is always important to discuss possible side effects with your doctor before starting any of these medications. The last significant risk factor that can lead to the development of depression is age. Depression typically occurs for the first time between 20 and 50 years of age. However, those over 65 are highly vulnerable to suffer with depression. There is no one cure for depression. Instead, people prone to developing it reduce their symptoms by implementing a variety of coping mechanisms that range from medicine to creative therapies. For most people, a combination of medicine with psychotherapy yields the best results. Here are a few of the most popular coping strategies today. Medicine is the most commonly known method of treatment. Frequently prescribed medicines used to combat the symptoms of depression are Zoloft, Prozac, Xanax, Abilify, and Effexor. Psychotherapy is another coping strategy that is done by a licensed clinician. It can take one of 2 forms: cognitive behavioral or interpersonal. Cognitive behavioral focuses on coping strategies for negative thoughts, while interpersonal helps the client build better relationships with the people close to them with the goal of forming a stronger support group. For some people, however, medication and therapy are not enough to treat their depression. Some of these alternative methods, used in combination with the right dose of their medication, can also be very effective. One way to reduce the symptoms of depression is by changing your diet to ensure you are getting all the recommended vitamins and nutrients you need to live a healthy life. Several studies have linked omega-3 fatty acids, vitamin B, and magnesium deficiencies to depression. Omega-3 fatty acids can be found in salmon, vitamin B can be found in fish, meat, and lentils, and magnesium can be found in leafy greens, avocados, and bananas. By adding these to your diet, one can eliminate their symptoms of depression significantly. Creative therapy has also been shown to be a great tool at combating the symptoms of depression. Even people who would not consider themselves as artistic have enjoyed and benefited from expressing themselves through a creative medium. Examples of creative therapy include art, such as painting or sculpting, dance, and music playing. A third alternative method for combating the symptoms of depression is exercise. Studies have shown that regular exercise can increase the influx of endorphins and stimulate norepinephrine in the brain. Presence of these hormones has a positive correlation to feelings of happiness. Single-person activities such as running, or ones done in a group such as soccer or basketball, are both great ways to relieve stress and reduce the likelihood of developing depression, or alleviate the symptoms if you currently suffer from them. In conclusion, although there are many ways to cope and alleviate the symptoms of depression, it is a serious illness that should not be taken lightly. If you or someone you know have any questions or concerns, below is the 24-hour number to call.